touch your nose with your index finger. Go ahead. And then you're going to touch my finger and you're going to go back and forth, nose, finger, as fast as you can. Ready? Finger, nose, finger, faster. Nose, finger, nose, finger. And then I switch my gaze from here to here because I want to know what is she doing when she reaches. Okay? Faster. Ready? Okay, good. Okay, let's do the other side. Ready? And go. Nose, finger, nose. Okay, and stop. Okay, so when you're doing this test, you need to make sure that your patient's full range of motion needs to be at full elbow extension and then come back. Because ataxia will affect every joint differently because there's torques here at the shoulder, torques at the elbow, torques at the wrist, okay? So they have harder times to move when there's so many joints moving at the same time. Versus if they're here, it's easier, right? They won't do as bad. But when you have them reach out, you will see the ataxia, okay? Or the dysmetria. So that is the main thing with this test, okay? So don't do it here. You need to have your patient do it full elbow extension and back. So you can even bring their arm kind of like just to measure it. Okay, go ahead and relax and you keep your finger right there, okay? You can do it, you know, if you want to use a tool, whatever, but you just give them a reach, okay? Usually it's finger to nose. When you give instructions, one of the things is they need to be attempting to do it if they can in an increased speed if they can, okay? But it's not a complete, like, you have to do it. Have you heard anything about that, Dr. Gate, about the speed of this test?
Typically, we do go tell them to go as fast as possible.
Right.
Because as the speed increases, remember we talked about the decomposition of movements with cerebellar ataxias. They're better at single joint movements. That's why you want at least a 90% of your reach, like Dr. Jimenez said, and you want to do them as fast as possible because they will slow down to control. It's a compensation also sometimes because they will slow down to have those less interjoint dynamic forces between the joint segments. And so you have to watch out for that. Can they go faster, or if they're going faster, is their movement becoming more hypermetric or dysmetric? So it's all about you know how she said, like how we said in lecture, the cerebellum is a comparator. It's comparing the predicted versus what's actually happening. So it keeps kind of, it's also sort of like the feedback loop that it has, it's also sort of starts acting like a game. So it gets an error signal, it tries to correct it, and then it's not correct, so it gets even worse. So they try to correct it and it gets even worse, so it becomes like a error amplifier of sorts in the brain. So you move them at different speeds, and that kind of really helps you, especially some of those higher functioning ones. Some of this will show up at the time.
Yeah, I mean, I agree. So, okay, so yeah, that's how I learn. I just wanted to take your take on the speed, because sometimes I see videos, like you will see videos on YouTube that they don't give that cue.
Exactly.
And so I was wondering, is it always with speed? So yes, your cue should be try and do as fast as you can. As fast as, yeah. So maybe their fast would be here, right? Not like us, but they're trying to do as fast as they can, okay? So all the cerebellar tests need to have some component of speed, okay? So that is a finger to nose.
It's not as fast in the one person, but there's no like.
It's just one of those gradients that so it's not exactly like a sensitivity specificity thing relating to speed. It is one of your screening things for more higher functioning cerebellar dysfunctions.
Yeah, just to see how if they can control the speed, because a component of movement is speed.
When you
right?
see a cerebellar patient, you will not mistake it the way that they are kind of just drifts and they have no sometimes sense of where their limb is sometimes. So you will not miss it. So these are just really gradients for more high functioning patients, and we are tying it to the mechanics of how cerebellum controls the movement. So you should know why to be tested like that.
Yeah, you won't miss